It is my pleasure to introduce Dr. Eric Westman. Dr. Westman is also from Durham, North Carolina, where he is a associate professor of medicine at Duke University. He's board certified in obesity medicine and internal medicine and founded the Duke Lifestyle Medicine Clinic in 2006 after years of researching low-carb ketogenic diets. Dr. Westman is past president of the Obesity Medicine Association and the author of the New York Times bestseller, The New Atkins for Renew You. He's also founder of Fuel Clinics, a clinic which seeks to treat diabetes and obesity with a low-carb ketogenic focus. There isn't a physician practicing in the world today who has more clinical experience with low-carb diets than Dr. Westman. We are grateful to have him join us today. Please welcome Dr. Eric Westman.
Thank you very much. And I wonder how many of you are following a keto or low-carb diet. Please raise your hand. So is it possible to get the lights on just for a moment? We'll wait just a sec. So I'd like to just have you look around to see if anyone else is doing a low-carb keto diet. So raise your hands. I guess you can see better than I can. How many of you have been following it for more than 6 months? Or a year? Just look around. I mean, 2 years? 5 years? 10 years? 20 years? I win. Something happened a year or 2 years ago where there was a popularity in low carb and keto, and I think I hope it continues, and that's really one reason why I'm here, to help spread the word and to help you see that you're not alone in doing this. I notice a lot of you did not raise your hands, and I wonder how many of you are dragged here by your spouse or someone else today? Yeah, so can you escort him out, please? No, everyone's welcome here. In fact, it's counter or cross-cultural, cross-religion. Hopefully you have enough time to tell you a story from my recent trip to Indonesia, which is largely a Muslim country, and the keto diet works in a great way there as well. So I'm going to try to share everything I've learned over the last 20 years in just this small amount of time. So keto medicine, what we've learned from clinical research in keto treating over 63,000 patients. And I just want to color the commentary a little bit. I don't know that I'm the most, maybe the most knowledgeable actively in practice for as a keto doctor, low-carb doctor, but Jackie Eberstein, who's one of my teachers, is probably one of the most knowledgeable people who are still alive. She outranks me in terms of knowledge, and I'm happy to have her on my team at the Heal Care Clinics. I got started in research in medicine, keto research in medicine in 1998. In the midst of all of those guideline changes that we heard, and wasn't that a great talk by Dr. Haidt about the guidelines? Going back, two of my patients did this kind of crazy diet. I'm eating just steak and eggs, and I wondered why. And they explained to me that it was a diet called the Atkins diet, and I said, I don't know. And then one of the men who did it, because they were pretty much all men at the VA, said, well, the book came out before you were born. And I said, now this is getting personal. So I went out and read the book and said, it's got to be bad for you, your cholesterol will go up and all that. And so what is a young researcher, I'm an internal medicine researcher learning about clinical trials, going to do? Well, I thought, let me look into it. So I looked and tried to find doctors who were still using this, and it turns out Dr. Atkins still had a practice in New York City. So I wrote him a letter, and he called me back, and long story short, it was, he said, why should I do research? I've already done this for 30 years. But he broke the ice by saying, why don't you come to New York City and look at our clinic? And so I did. I returned skeptical, but open-minded, and started my own research program at Duke University. Oh, that's me in the picture there on the far right from our first visit to the Atkins Center in 1998. Dr. Atkins in the middle, and Jackie Eberstein, who's still working with me on the right from that first visit. And I did meet Dr. Atkins a few times, borrowed their very brief clinical instructional page, and started to do research back in North Carolina. So I never really worked for Dr. Atkins. I visited him enough to ask him for money to fund our research, and he did. And it was out of his first checkbook, personal check, written to Duke University for that first study. 20 years later, this is what I do. I'm dedicated to keto medicine and passionate about sharing what I see in my clinical practice with everyone else in the world. So we've published 46 peer-reviewed papers, Dr. Yancey and I, at Duke, and he has work funded through the Veterans Affairs, Department of Veterans Affairs as well. We opened a clinic in 2006, and Dr. Haidt, then not Dr. Haidt, but she helped me start the practice and got a great clinical exposure, knowing what you can't unsee. I mean, if you're in a clinic like this, you see it, it's just so different than any other kind of practice. And looking back, that's how I learned about it. I was invited to the Dr. Atkins clinic in New York City, so I saw that it worked. And yet when I went back to my hometown researchers, they said, you know, the failure of belief in what Dr. Atkins was doing was so big. My researchers back in Durham said, well, we think Dr. Atkins hired Broadway performers to pretend to be patients. Wow. Looking back, I mean, you just have to understand that that was 20 years ago for me. And so I want to bring you up to speed with what I've learned since then. Yes, I wrote 3 books, The New Atkins for New You, Keto Clarity, and Cholesterol Clarity. I don't receive royalties from the Atkins book, sadly. It's probably the best one that sold the most, but I do receive royalties from Keto Clarity and Cholesterol Clarity. Jimmy Moore has been a fantastic, prolific writer and seeker, putting all of what he's learned into books, and I helped him on these 2. Then I co-founded 2 companies in 2014 because I've seen this work, I believe in it, and we're trying to give that information to other people in a way to scale it up using the scalability of business. So at the Duke Lifestyle Medicine Clinic, I've seen, we finally had a student come through to do some research in the computer system that he was very familiar with. We treated over 4,000 people at Duke, and it's kind of known as the clinic of last resort because people have tried everything else. And this is often the last ditch effort before they go to the surgical colleagues of mine down the street for bariatric surgery. So we've treated people with metabolic and inflammation problems like obesity, type 1 and 2 diabetes, polycystic ovary syndrome, which is a cause of infertility in women, IBS, irritable bowel syndrome, NAFLD, non-alcoholic fatty liver disease, which is becoming one of the more common reasons for liver transplant. I actually had an awkward discussion with someone who had already had a transplanted liver now, for fatty liver, that was the cause of the transplant, and now the fatty liver was coming back in the transplanted liver, and no one was teaching this person how to eat, to not get the transplant liver full of fatty liver again. So I got to help that. And GERD or acid reflux, this is almost 100%. It's gone in a week. And yet the mainstream medical people don't know it. Another theme here is the mainstream medical people don't know this. You talk to a GI doctor about fatty liver, they'll say, oh, fat in the liver, cut out fat in the food. No, it's the carbs that cause the fat in the liver. It's the carbs that cause the acid reflux, not the fat or not the chocolate. Much of my chocolate lovers love that idea, right? So Actually, it's the carbs that cause the acid reflux. We have 2 papers written now over 10 years ago that nobody looks at, nobody reads. Now my data are so old in the published literature that they can't be used in PhD theses. Because it's over 8 years, someone came to me, well, Dr. Westman, I can't use your studies because they won't allow it, it's so old. Studies, not me, but lymphedema, there's no answer for this if you read the internet. If you read the internet, but an occupational therapist in Central California started a study doing this, and now the keto diet is being used for lymphedema, and it's getting more, she got the abstract of the year last year for her research, and now the word is getting out that yes, there are things you can do for those problems. Cardiovascular disease, heart failure, and pre-transplant heart transplant patients, these are probably the sickest people who are still walking around. The heart failure is so bad they have to put an implanted pump inside, and there are tubes that go to the heart and the aorta, the big artery there, and I do a modified version of a keto diet where you have to watch the salt and the water and the vitamin K because they're on Coumadin for blood thinner. And even these people, there's one person who may not need a heart transplant anymore because it was the obesity that was causing the heart to not work as well. So, and yet we've also helped send some people on for heart transplant too. I guess I'm trying to give you an idea of if someone says, is this safe? Can you do this in me? And just look at the types of people that we've treated. I mean, this isn't just your general person who needs to lose a little bit of weight. These are people on often 10 to 15 medications that we help get off those medicines, help them lose the weight. So we've learned a wide range of usefulness of this approach beyond just the watching a little bit of weight and weight loss. Post-bariatric surgery, weight regain, it's frustrating for a lot of people to think that I got the surgery and that wasn't enough. So bariatric surgery looks really good at 18 months. Just about everyone loses weight, but at 3 years and 5 years and then at 10 years, about half the people who've had even the most severe bariatric surgery will regain all of their weight if they don't understand lifestyle change. And in my world, it's the keto diet because it's so simple, hunger goes away, and so eventually you're going to have to address the lifestyle even if you've had surgery to try to fix this problem. Weight gain caused by medications, steroids, antidepressants, and other psych meds. Had some visitors to the clinic to learn what I do, and we were watching this patient. She was on 10 milligrams of prednisone every day, which generally makes everyone gain weight, and this person was successfully losing weight. So even this kind of approach can work in situations where medicines pretty much always cause weight gain. Some cancer therapies make people gain weight, and this diet, in addition to the other cancer treatments, can actually make you not gain the weight, where a lot of people do with prostate cancer treatments, breast cancer treatments. So I really see this as an adjunct to those kinds of treatments too. For type 2 diabetes, I mean, it's kind of a no-brainer because no-brainered. Yes, Brainerd. So because what raises the blood sugar, it's sugar. And diabetes is a condition of elevated blood sugar. Why would you ever want to eat something or drink something that has sugar when the problem is too much sugar in the blood? So, I mean, it's fascinating that the medical mainstream thinks that there's some problem that you need a medicine for. In fact, when you check the insulin level in people with type 2 diabetes, the insulin level is already too high. You don't give insulin to someone who has type 2 diabetes when the internal insulin level is already too high. This is crazy. And yet that's what 95% of the medical mainstream do. It's called endocrinology. And I'm in that world of internal medicine and all this, but they just don't understand this. So this, you add up all of the insulin on the far here in red. This person was on 500 insulin units per day. Just add them all up. If someone has pretty good control, you have to cut the insulin in half on the first day. Otherwise, you risk a low blood sugar. And we don't want low blood sugars. You can pass out, can be life-threatening actually. So, do this with someone who understands it if you're taking medicine like this. This person in the green and gray, they were on these people 150 units of insulin a day, cutting them down. And you can see when the number gets down to 0, the 4-week reduction or elimination of insulin is almost 100%. So I've had people who've been on insulin for 25 years come off of their insulin within 4 weeks. And then you get into the issue of how did this happen, and the guidelines, and so I used to be more fascinated with the history. I'm a history major in college, but now I think we can even do better than the history. I think we can figure out ways to even go beyond what we learned, and that's called science, right? So anyway, it's very gratifying to take people off their insulin. There are no more grateful patients than those who don't have to prick their finger anymore or inject insulin, and because other doctors have told them they'll have diabetes forever, that you're going to have that forever, and then go down the path to amputations or blindness or renal failure and dialysis. You don't have to go down that path. That's why this is my first reason why we need a new discipline called keto medicine or something like that, because the current medical mainstream, and I'm still in it, I'm full-time at Duke University, the current mainstream don't get it. And if you go down that path, the human cost is enormous. So you don't have to go down that path. It is all about the people. While there's this hue and cry and debate going on and controversy, like Dr. Atkins and Jackie Eberstein, a generation before me, they went to work because they saw this every day. This person losing 230 pounds and sustaining it said, for the first time in my life, I'm no longer at war with food, my scale, and best of all, myself. It's remarkable, and thank you for your stories here today. It works even in Minnesota, and as you saw, a lot of you are already doing it. Another patient lost 130 pounds, eliminated all medications after decades of diabetes. After 10 years taking diabetes medicines, my doctor prescribed insulin. I searched for a better answer because I didn't want to have diabetes in the first place. The disease went away with a low-carb diet and no more medicine. And the hemoglobin A1C, which is the long-term indicator of blood glucose control, went from 8.4% to 5.7%. I want for you a normal hemoglobin A1C off medication, and that is achievable for just about everyone with type 2 diabetes. In 2014, after a couple entrepreneurs came to me and said, Dr. Westman, how many people have you treated at Duke? Well, let's see, we added up about 5,000 people. Oh, well, that's great, Doc, but how many people need this? 50 million people? So how are you going to do that in your lifetime? Well, I don't know. How about make some companies train all these new people, train an army of people to do this? Okay, let's do it. So in 2014, I co-created the Heal Care program with nurse Jackie Eberstein, Dr. Atkins' nurse, Jackie Eberstein, who I think is the most knowledgeable person about this approach, and she helped me create the clinical care protocols. She worked with Dr. Atkins and treated 60,000 patients there. She steered me into keto medicine. In fact, it was her clinic room that I sat in when those Broadway performers were supposed to be patients, and they brought in their cholesterol levels with their names, and somehow those Broadway performers are pretty sneaky how they changed all that. And okay, this is called sarcasm, and I know it's hard for me to do that and hard for you to realize a doctor might use sarcasm, but it's an emotional way to deal with this enormous issue. So anyway, Jackie is still around, helps me at Heal Clinics, and thank you for those of you who helped us through an online public offering. Several of you came up already and said you were investors in the healclinics.com, Heal Clinics, Thank you very much. We hope to change the world by creating an army of practitioners like Jackie and like me. Another entrepreneur approached me and said, you really need to help fix this, and a big problem for a lot of people is they don't have convenience foods. And as we've learned from Dr. Haidt's presentation, one of the things I got away is that we have all been conditioned to have convenience foods. So if you don't help develop those things, you're going to lose out on a niche. And so I was talked into helping with Adapt Your Life, and they have these keto mini bars, which are very delicious, not as a meal replacement, but just as every now and then, if you like something that's very clean food, and check out adaptyourlife.com. Well, back to the more science and serious side, there are 4 key conclusions from the research and keto treatment of the 65,000 patients that Jackie Everstein and I have treated. Number 1 is keto is safe. Number 2, keto is effective for more than type 2 diabetes, prediabetes, and obesity, which may be what I end up in helping the Heal Care clinics help people down the road with these other conditions, not just diabetes and obesity. Number 3, keto works for virtually everyone when it's done right. And now I'm finding that I'm helping a lot of people unlearn what they're learning in the pop culture view of how to do this. So I hope to share at least a glimpse at how you can do this in a simpler, effective way. And then the last thing I'd like to touch on is keto requires a new medical normal for understanding how the body works, the metabolism, and when you check blood values, what you have in the blood when you don't eat carbohydrates may be different from those who eat carbohydrates, which those who eat carbohydrates are basically the ones that create the normal, quote, normal range. So don't be disturbed if your blood sugar or blood ketones or blood cholesterol are outside the, quote, normal range. So we'll get to that at the end. So what makes me say that keto is safe, other than using this in 5,000 or 65,000 patients? And you still hear that it's not safe. The myth lives on. You went on Atkins or today keto. You lost 90 pounds, lowered your cholesterol, cured your high blood pressure. Now you're walking 5 miles a day. But I'm warning you, a low-carb, a keto diet, a high-fat diet is harmful for your health. So having seen this cartoon for now 20 years, I mean, it makes me kind of laugh. I mean, what's the doctor doing, right? So, oh, right, you probably just saw your doctor yesterday, and that's what they said. But remember, for me, it was 20 years ago when I was first faced with someone doing this. And here's why I think it's safe and effective. In fact, the research and clinical experience is creating a body of evidence that surpasses the level of evidence that would be required for an approval of a drug at the US FDA. And that was my prior research experience. I helped do the clinical studies to get FDA approval for different drugs. It was in the smoking cessation world. And actually the level of evidence is such that if it were a drug, it would be FDA approved. Now what I've learned is that it may be as strong as 10 drugs. If you're using 3 drugs for diabetes, 3 drugs for hypertension, you're on an arthritis medicine and a heartburn medicine. Okay, that was 8 medicines. But so I can take people off all of those medicines. Now the irony or just the reality is that there's no process for a diet approval. They just give guidelines. So you have to look at the evidence. You can get a handout of all the evidence at healclinics.com, or you can go to the Public Health Collaboration of the UK, download their infographic or all of the tables of low-carb, low-fat studies that is put together to make this statement. And you can, in your doctor's office, pull this up and say, well, look, here's the evidence. And your doctor may ignore it or learn from you as well. So there's so much evidence now that it's a matter of how do I communicate it quickly. So thanks to Sam Feltham and the Public Health Collaboration of the UK for putting together this infographic. It makes it very easy to get access to this information. So keto is effective for not only type 2 diabetes, prediabetes, and obesity, and the downstream consequences. So basically every organ system that I learned about in internal medicine is impacted favorably, so that we can reverse diabetes and the downstream consequences of heart disease from that, the high blood pressure, the kidney disease that occurs from high blood pressure or diabetes, the atherosclerosis, it's just actually pretty amazing how these things can get better. Now that we can study the keto or low-carb diets, there's a conference that occurs usually in January called the Metabolic Health Summit. I've seen several of you there before. There's also a new conference at Ohio State, conference on nutritional ketosis. There's strong evidence on the left-hand side for cardiovascular disease, risk factor markers, epilepsy, GERD, or acid reflux, polycystic ovary syndrome, NAFLD or non-alcoholic fatty liver, irritable bowel syndrome. There's strong evidence, and the story here is that people with this uncommon or rare disease called McArdle's figured out that they could fix their own problem by just not eating carbohydrates, which is really what a keto diet is. What happens is you turn your body from, let's say you burn what you eat, so if you eat carbohydrates, the sugars and starches, you have to burn them. So if you don't eat the sugars and starches, you just don't burn them inside, and your body becomes a fat-burning machine. And that's really good if you're trying to lose your body fat, because that's how you lose it. You start burning your own body fat. That's why the hunger goes away after a day or two after eating this way. And that's why it's so effective as a weight loss tool, because you don't have hunger when you're losing weight. But for McArdle's, these are people who have trouble using sugar in their muscle. These are people, the average age of diagnosis is 30 years old. And these are the kids who walk and they stop every 50 yards and they pretend to tie their shoe because they're just so out of energy. And nobody really, they just figure that they're just, it's just them. And you actually do muscle biopsies, and all the CK levels are really high. The creatine kinase muscle enzymes are really high, and it turns out they can't burn sugar well in their muscle. So the traditional teaching was, well, we'll wake up the children at night and feed them sugar so that they'd have enough sugar for their muscles. Well, it was only after people started doing this and thinking, well, what if the muscle used fat for energy? Because muscles can use fat for energy. In fact, it's preferred for muscle to use fat for energy. But if you eat sugar and you burn sugar, then you can't burn fat. So these folks are fixing themselves by becoming fat-burning machines and having their muscles burn fat, even though the medical establishment was clueless about it. I was invited to a meeting just last fall where the world's researchers came in for McArdle, or glycogen storage disease number 4, and the world experts said these people can't be true. They must not have been diagnosed correctly, because this disease never gets better. Okay, I'm trying to be a little ironic or tragic. You might hear a doctor say, you'll have type 2 diabetes forever. Well, because they have never seen someone get better. These researchers blamed the patient for being misdiagnosed when they were fixing themselves. Now, in this small group of world researchers, there was already a group in Copenhagen who were trying to study this disease. They had heard the clinical experience. They saw, there were hundreds of people in a Facebook group with this disease getting better, having all these testimonials. And the group in Copenhagen that was trying to figure out how to study this were committing all of the newbie errors that someone who never really used this approach would commit. They'd commit an error, they want to do it just for a week, and they'll see how people do. When we know that it takes 2 weeks to 4 weeks for your body to fully adapt to keto lifestyle, to a fat-burning lifestyle. So the brilliant individual with McCardle herself, who put this all together, said, I'm going to bring Dr. Westman here because he's going to say, no, actually, we've used this in lots and lots of people, and we're going to do the research correctly. So it's just really neat to be a part of this, people fixing their problem, to connect with the academic world, and I believe this is just the beginning of academia figuring out that actually most of the human body does great running on fat for energy, not just carbohydrate for energy. And so this is why it's an exciting time for the research on low carb and keto, and pay attention. And now you can just go to YouTube and watch the videos from the conference that happened just a few months ago. Libido getting better, erectile dysfunction, traumatic brain injury, orthopedics, pain management, to speak at a chronic pain interventional conference just a few weeks ago, and they're already using keto to get people off opioids and to treat chronic pain. And evolving evidence, so the way I put this slide together is as you go to the right, there's less evidence. So fewer studies published, but the basic science is very compelling, and I look forward to more research in the neurodegenerative diseases, Alzheimer's, Parkinson's, dementia, and even cancer treatments. But I would say that's evolving. You can't sign off on these conditions like you can for diabetes and obesity, but it's really exciting to see the possibilities there. And we'll get a talk about that in Alzheimer's today from Amy Berger. But so this brings me to the question of, should we consider keto medicine as a new medical specialty? Being keto treatment-centric rather than condition-centric. And in my world in internal medicine at a major academic medical center, my cardiovascular disease specialists are really good at doing cardiac catheterizations and putting stents in, and then sending me patients when the heart failure is so bad they are putting implants in. It's a failure in prevention. And we joke that a cardiologist, all they know about food is that a banana has potassium. And those of you who have talked to a cardiologist and you're on a diet or a drug that depletes potassium will be told to eat bananas. But they're too high in carbs, so we have other ways to get potassium. Metabolic endocrinology, I already alluded to the fact that they are wedded to the drug treatment of diabetes, not the lifestyle treatment, sadly. Cognitive impairment, neurologists, aside from the pediatric neurologists, they know that cutting carbs out and having a keto diet can actually fix childhood epilepsy. They've known that for 100 years, and a center at Johns Hopkins was continued by the brute force of one woman who was continuing the treatment through the dark days of the 80s and 90s. In fact, that program would have died had she not continued the treatment of children with the keto diet, ketogenic diet for epilepsy. In fact, the Charlie Foundation was started because of a boy named Charlie who had seizure disorder, and the parents were told they had to have a brain operation, and they said, well, we're not ready for that. They found the ketogenic diet at Johns Hopkins and created the Charlie Foundation to broaden the exposure and teaching of the ketogenic diet for childhood epilepsy. This year I met Charlie at the Metabolic Health Summit because it was in Long Beach, and that's where the Abrams live. That's Charlie's parents. They made a movie with Meryl Streep called First Do No Harm. It's still a classic movie. The more modern version of that for keto is The Magic Pill, which is on Netflix, so you can get access to this information even if all you do is want to watch documentary films. So Charlie is actually 23 years old now and works as he teaches little children, childhood kindergarten teacher or preschool. So gastrointestinal GI, we joke that the only thing a GI doctor today knows about diet is you need more fiber. You need more fiber. And so, no, actually, there's no evidence that you need more fiber, except this is what is perpetuated. My GI doctors at Duke are very good at, and I use them, when I need a preventive measure to make sure I don't get colon cancer, for example. And I remember meeting the world's expert on irritable bowel syndrome. So this, you would think a doctor who talks to people with trouble with their stomach might know something about food, because you eat and drink and then it goes in your stomach. I laugh because looking back, it's just really sad that this world expert was studying the brain, not the gut. And I asked, well, what foods worsen irritable bowel syndrome? And he said, well, fat, you have fat and it reduces stomach delay, absorption. And I said, you don't know anything about diet and irritable bowel syndrome, do you? Well, no, I don't. This is a world expert in irritable bowel syndrome some years ago. But and our paper on that, again, was written and published so long ago, you can't include it in your PhD thesis today, sadly. So all of, it just occurs to me that I'm treating all of these issues that an internal medicine specialist, a chronic disease specialist in the US would treat. And yet our current educational system doesn't provide any of it. So keto works for virtually everyone when it's done right. And this is going to keep me and Jackie in business for a long time because people are getting the wrong messages, although keto has never been as popular as it is today, and I think that's a good thing. But what you really want to know about a keto diet, the most important thing is to keep the carbohydrates low. I just came back from a meeting out at the CrossFit headquarters, and CrossFit gyms are getting into this in a big way because while it's an exercise kind of program, the CrossFit in 100 words starts with nutrition. So even if you're into health and you know about exercise, the exercise folks know that nutrition comes first. So they have a new saying in their CrossFit health group that they're rolling out: off the carbs, off the couch. Off the carbs, off the couch, and in that order. And they're actually making it easier and easier for people to get involved with getting back into exercise. Although I had the good fortune to speak in front of the group, and I said, I have to tell you to do this without any exercise or any CrossFit gym at all. Actually, most of the people who come to me don't have the energy to exercise, so I don't even bring it up. Because when you get the carbs low enough, 50 grams a day or 20 grams, and this is total grams, not net grams, you're going to be in ketosis. You don't even have to measure ketones. But so I want you to remember the most important thing to become a fat burner is to keep the carbs low. You don't have to eat or drink ketones or eat more fat, especially when you're using your own body fat. You don't have to eat fat create ketones. You're making ketones from your own body fat. So today, while you may have come into this thinking about ketones, it's more important for you to remember to keep the carbs low and that protein comes first. So all the nutritional experts focus on protein being the most important thing when you're just eating food in general. So keep the carbs low. Our teaching program is pretty simple, and in North Carolina, where I work, this was very helpful, keeping it simple. And it fits all in one sheet of paper. You can actually download what's been known now as page 4 on Pinterest, and page 4 because it's the 4th page of our clinical handout. In essence, the way we teach is you can eat as much as you want of the real food, animal foods with protein and fat. You'll get the fat with the proteins. That means you can have as much as you want of the meat, poultry, fish and shellfish, and eggs. But I know you're not going to want much. And that there's a little play on words there because your hunger goes away after a day or two and you eat less automatically. Of course, the studies that were published that show that are the best one being Gunther Boden in 2005, Annals of Internal Medicine. All you had to do is tell people to eat real foods and not eat carbohydrates, and they matched the amount of calories and proteins automatically. So I don't have to count calories. You don't have to count calories. You just keep the carbs low. You reduce the calories automatically. You reduce the amount of food automatically. You do have to have some salad greens and non-starchy veggies, but the amount is limited. Roughly 2 fistfuls or 2 cupfuls of salad greens, about 1 cupful or 1 fistful of non-starchy veggies. In our area, most people eat asparagus, broccoli, Brussels sprouts, cauliflower. Have you found, can you get riced cauliflower in the grocery store here? And cauliflower, mashed cauliflower, cauli tots. Have you seen those yet? Yeah, they're not tater tots. They're made of cauli. Tater means potato, right? So it's cauli tots. Yeah, we're getting those. And it used to be we had to make your own cauliflower rice. Now you can get it at the store, so it's more accessible. And then a limited amount of cheese, creams, oils, mayonnaise. Probably the most common mistakes I see here is that people are over-consuming cheese because there's that's my alarm to wrap up. Most common mistakes I see are people eating too much cheese. If you're counting carbs even, and it says 0 carbs, you think you can have as much as you want, when actually the high calorie items, the cream, cheese, mayonnaise, need to be limited. That's a limitation that happens here on page 4. Another common mistake is overeating the vegetables. Because, if a vegetable is put on salad greens, it doesn't turn into salad greens. So if you're eating vegetables, it's, you have to count all of those as part of your vegetable allotment. But a pretty simple system, which is part of the strength of doing this too. So another part of my thinking that why we need a new specialty is that medicine is not the most important therapeutic factor. And while I know about medications and I need to know about them to take you off the medications, I do a lot of other things that I don't really get training for in medical school. So I counsel, I guide people, I cheerlead them. I am a detective, and we support. We try to uncomplicate things. We bring people back to the basics of what works, allowing people to, always be in a supportive environment, no matter what else has happened. That's a really important factor, important principle. So whether it's working or not, just a few things that might apply to you. I don't know if you go out and have fruit water, because I didn't tell you you couldn't have pineapple water. You might do it, and so this person came back and said, well, explain to me how you make your pineapple water. Because I don't make people write down what they do at home. There's too much work. You don't have to use an app or anything, but they do write down what they're eating when they come back to the clinic, and I see this pineapple water. So how do you make it? Well, I take the can of pineapple, put it in the pitcher with the syrup. Oh yeah, and then I pour the water in, and is it sweet? Oh yeah. Okay, so this is a source of sugar, but I didn't say no pineapple water. And in the South, if you order tea, you get sweet tea, so you have to order unsweet tea. So in some people's brains, tea isn't under all beverages that contain sugar. And so this is one reason why people, I teach them and I have them come back. It's important to have the follow-up, because I need to know how your brain works. You have to do this 24/7. One gentleman was coming back, it's not working. I said, well, tell me what you're doing. It's not working. And then I come to find out later on, he said, well, I was doing your diet. I was doing it 23 hours, 59 minutes, and 30 seconds every day. What were you doing in those 30 seconds? Well, I was getting up in the middle of the night and getting my Oreo cookies, dipping them in water. Well, that's going to stop your fat burning, and of course it's not going to work. New medications, this time of year, I screen for those steroid nasal sprays. If the weight loss stops, someone's starting to gain weight. I don't understand what's going on. Are you on any new medicines? Oh, no. Any new nasal sprays? Oh, yeah. This, not to mention a brand name, but so other doctors, it's very effective to lower allergies. It's also very effective at making you gain weight. So I'll screen for all these steroid shots, things like that. I mean, you just have to understand this is a factor that's important to keep in mind. This other gentleman, I do believe in, and I will go to bat. If you say you're following it, I will believe you and try to figure out the other cause of why it's not working. This gentleman didn't lose weight. He's lost 5, I see 1 to 2 pounds per week, so that's 4 to 8 pounds per month when it's going right. He lost 5 pounds every month, and then it stopped. And I said, well, what's different? Nothing. Nothing's different. Well, but, I've been strict. I've been, so was there anything else that happened? And he said, well, I did have a new prosthetic leg put on. I said, well, tell me more. Well, and it's a new leg because I have the Duke emblem on the front and the UNC emblem on the back. So it raised the weight about 5 pounds of my prosthetic leg on the far right there. That is why he didn't lose weight, because his leg weighed more. Now, if you are treating someone at a distance and asking all those questions, anyway, so there may be other reasons of why it's not working, and these are not excuses for you to go back and have sugar, which is probably the habit and the addiction that most of us are fighting. So people fail, or the program fails, mainly for psychosocial reasons. This is why we have coaches. This is why we have counselors. This is why in our new company, Heal Clinics, we have individualized coaching once a week with a partner and individualized group coaching, because that is, it's one thing to know the food, and a certain percentage of folks will do great just following the list, but most people need some sort of support as they're transitioning to this lifestyle. So we built that in. Just to end up on a few things, every new day is a chance to start again, and the emotions that people bring in are deep, it can be lifelong, and we support everyone, and every day is a chance to start again. I deal with people who they're waiting for the shoe to drop of this to stop working, because every other approach they've done stopped working at some point, and they regained all their weight, even hundreds of pounds. So I deal with people who've lost hundreds of pounds and regained it, hundreds of pounds. Not yet another diet, it's just going to stop working. No, it will always work, because this is the root cause. It's the guiding element of how we gain weight and how we keep it off. It's the carbohydrates. It's the sugars and starches. It's not the fat in the food. Our Heal Clinic already has some preliminary results. This is why we say if you do it, it'll work. Here, showing each individual here, and the medical program on the left. If you don't have a medical problem, we have a non-medical program where we will teach you at a distance with a simple method that Jackie and I have used for years. And you can see just about everyone has lost weight. I include the people in the top, those who gain a little bit of weight. They weren't doing it for weight loss, actually. One fellow I have seen, it's a caveat, just be careful, he lost too much weight doing this. I thought, that's unusual. I rarely see someone who has that complaint. Well, I asked him what he was doing, and he was making these kale, apple cider vinegar shakes that some promoters of this way of eating are saying you have to have in order for it to work. And I said, well, what are you eating? He said, well, nothing, because the apple cider vinegar takes away my hunger. I'm not hungry. I said, well, but where's the food? Where's the protein and all that? So just be careful about the programs that say you must buy this, you must buy that, and then if you're not hungry, just don't eat, because no, protein comes first. And it's not a keto this, keto that. It's keeping the carbs low, and then ketones come from within. And of course, A1C being a reflection of diabetes also gets better. These are people not in research studies. This is real-world data from the company. So I'm just going to end on probably the idea that will keep me in business for a long time. People fly to me from parts of the country to talk about the LDL cholesterol. Is anyone worried about that? It was the new medical normal idea, if you think about what people on a keto diet eat, it's abnormal. Someone might even think you have an eating disorder when actually you're healthy and you're fixing your medical problems. Your eating behaviors are different. You might eat once a day. It's okay. If you're eating great food and you're not hungry, your ketone levels are high. They're abnormal. Oh, wait. They're not abnormal if you're in nutritional ketosis. You're different. Your medical doctor may not even know about this. So abnormality just doesn't mean it's wrong or unhealthy. It's just different in that case. Weight loss is achieved by lowering the caloric intake, and after a while, people now they understand that. Okay, you can lower calorie levels, and the Obesity Medicine Association actually has a keto diet in their guideline, so it actually is becoming mainstream in that world anyway. Glucose insulin levels get better, diabetes gets better, and that fits. But now what about the lipids? And I'm just going to fast forward for time. This is how you normally define normal and meanings of normal. And you know, I noticed that I was short in Sweden with Andreas Ienfeldt there, and I was tall in China when I was teaching at a hospital there. So normal is relative. And then all of the new tools, I'm talking to people who are worried about their blood pressure and blood sugars going up and down. It's just normal variation in most cases. So I just want to end on the keto normal for cholesterol, because the old way of looking at cholesterol focused on total LDL, total cholesterol and LDL. And you can just expect the older doctor, well, anyone who's been in the mainstream medical world, think about total and LDL cholesterol. That's the way they were taught. But actually the metabolic syndrome, or the new keto normal, goes way back to Jerry Reven, Professor Reven at Stanford, and then Jeff Volek at University of Connecticut, and now Ohio State. And what they've known for a long time, it just was kind of the minority opinion, if you will, is that metabolic syndrome is the cause of atherosclerosis and heart disease. So you focus on triglyceride in the blood and HDL in the blood. You focus on the abdominal circumference, the blood pressure, and the blood sugar or blood glucose, and you don't worry about the total cholesterol and LDL. I know that it'll be a shock to many of you, but it's always been there. It's just been the minority opinion. And in the medical world, what happens with the minority opinion, where you don't have money and you don't have drugs to treat it, is that it gets squelched. It's not that it doesn't work, it's just that nobody talks about it. So I'm going to sum up by, I hope I convince you that keto is safe. It would have met the criteria for FDA approval for a drug if there was that process for a diet. Keto is showing clinical value for many other conditions, and I'm learning about new conditions all the time. People come up to me at conferences like this showing me diseases that are better, I mean ones that are, you know, they can show publicly. And then it's just fascinating to be at this time point because the resistance is fading away. The clinical and your experience is just so powerful. And keto works for virtually everyone when it's done right. So if it's not working right for you, find someone who knows how to do it, has experience with it. There's a new specialty called keto medicine, and I'm hoping very soon to roll out the first keto medicine clinic at Duke University. I'm working on that. Once I learned recently that lifestyle medicine clinic is a euphemism for a plant-based Seventh-day Adventist type of clinic, I want to distance myself and Duke away from that. Caution is required when comparing labs from those in nutritional ketosis, not eating carbs, to those, quote, normal values from people who eat carbohydrates. So if you get a lab value like that, don't freak out. You know, you're not on the edge of a cliff. You know, like, has your doctor made you feel like you were on the edge of a cliff and it's dangerous? No, it's something you just want to discuss with somebody who understands how to do this and look at those labs. So, you know, do I have just 2 minutes left. Jeremiah, am I okay? Not hearing otherwise. I bring greetings and just an amazing story from the country of Indonesia. In that country, it's a relatively poor country. They have enough people, just as many people as in the U.S., and they're on 10,000 different islands. And an engineer father was told that his son would never walk, would never talk, and the diagnosis was cerebral palsy. So Brother Tio, Mas Tio, asked, like any engineer, well, how do you fix this? And the doctor said they did a scan, and they said, well, there's not enough myelin in the brain, and there's nothing we can do. So ever the engineer, citizen, scientist, kind of like Charlie Foundation. Charlie was the son, and the Lorenzo's Oil, the movie where the parents went to the library and figured out their child's condition. Tio went to the research, it's called, the internet, and it turns out myelin is made with cholesterol in the brain. And you can't get cholesterol in the brain by eating it. You take cholesterol, or you take ketones into the brain to make the myelin. So ketones were important for my child. So the keto diet for epilepsy is out there. He read about it. He put his son, Alif, on the keto diet 10 years ago. So now Tio, so affected, the father starts teaching. He loses 50 pounds himself. He talks to doctors and other people like this around Indonesia. And he's created a group on Facebook called the Keto Fastosis Warriors. Keto Fastosis Indonesia is the Facebook group. It is all in Indonesian, for those of you who want to join, I think, but most of them know English, thankfully. So he put on a conference, 3-day conference with scientists and Indonesian doctors. There was a group of about 350 people like this. And it was inspiring with all the stories, and I've never had so many selfie photos done in one day, because they're all doing selfies, and there was no boundary of anyway, a lot of hugging is what I'm trying to say. The conference is over. We're standing with our Keto Fastosis cult, I don't know what it is, like a group symbol. This is a K for Keto Fastosis. And we have flowers, because at the end of the conference we all had photos up on stage. I heard this murmuring over on the side, and it turned out that Alif was there, and the son who started this all 10 years ago, and he walks up on the stage. There's not a dry eye in the place when Alif comes walking on the stage, kind of, being shy, and he didn't want to be up there, and just, to watch the dad see his son walk on stage, going against everything that he's been taught, everything that the doctor said nothing would work, was very moving, very inspiring. And I have to just share that with you, because you may have to go against the story you've been told. You may have people in your life who are not healthy, and you see them get better. Anyway, so I got to sit next to Brother Tio, Mas Tio, and it was probably for Georgia Eid, who was invited there. She wrote a wonderful blog about our visit there. Check it out. She doesn't talk about Alif coming onto the stage, but if you're ever getting the pushback, you're feeling great, you're doing this, the science is solid. There's some other reason why people don't want you to do this, and as we've learned today from Dr. Haidt, it's mainly politics and money and all that, but I bring you greetings from the Keto Warriors, and our meeting was in Jakarta just a few weeks ago. So thank you so much.